In the rapidly changing realm of women's healthcare, we live in an extraordinary time. The strides made in surgical care of patients are astounding, for at our fingertips are some of the most advanced treatment options we've ever seen, especially for women who must undergo procedures for these and other conditions.
The first hysterectomies were done probably around the turn of the 19th century, which really consisted of abdominal hysterectomies, which consists of a large incision in the abdomen, and the other type was a vaginal hysterectomy. All the surgical approach was through the vagina, and the recovery period was much better for that type of surgery. In the 1980s, a laparoscopic hysterectomy was kind of added to the armamentarium, and it enabled them to do the same type of surgery, but just with smaller incisions. Better recovery for the patient, less pain, quicker return to work. But it was somewhat limiting due to the visibility, the instruments used, and so around 2000, the first robot was introduced, and around 2005, the first robotic hysterectomy was performed.
Robotic-assisted hysterectomies are one of the most important developments in the history of women's healthcare because of the fact that the benefits far outweigh those of traditional open procedures.
There are dramatic differences when you're comparing robotically assisted surgery versus traditional open surgery. Day of surgery, blood loss is dramatically less. Pain the day of surgery is significantly reduced due to the small incisions and not disrupting the patient's muscles as dramatically. As they're recovering, the majority of patients use significantly less narcotics and pain medication, and then return to work is usually 2 weeks versus 4 to 6 weeks.
With such critical benefits on the line, it begs the question, how does robotic surgery work?
Robotic surgery is about advanced laparoscopic surgery. What it gives us is a three-dimensional view of the abdomen, and then with the equipment that we use, we get a lot more dexterity and flexibility. With the instruments, we place 3 to 5 laparoscopic ports, and then we place our instruments through those ports, and then we do the surgery actually on a console that's a few feet away from the patient. In the console are little fingertip controls, and then kind of like a binocular view that gives us that three-dimensional view of the abdomen. With that three-dimensional view, we can do a lot more advanced surgeries.
I was comfortable choosing robotic surgery due to the less invasive nature of the procedure and the faster, quicker recovery time.
Given all the advantages of robotically assisted surgery, only a fraction of these procedures are performed this way. Why? Because most patients don't know it's an option. Doctors Putman, Riley, and Singh of Seven Hills Women's Health Centers in Cincinnati, Ohio, perform 90% of their surgeries using minimally invasive techniques and say that more doctors should be offering it to their patients.
It's really just getting the information out to patients. It's a new procedure to the patients, also a new procedure to a lot of the doctors, and the timing and training that's necessary to get trained in this is significant, and not all surgeons at this point have been trained. So when patients go to their physicians to talk about the options of a hysterectomy, this may not always be discussed.
My recovery time was very fast. Within a week, I felt very good, and in less than 2 weeks, I was attending a school dance with my son, and I was able to keep up with him.
A generation ago, this would have seemed impossible, but today's advancements in surgical techniques are paving the way for higher standards of care and outstanding patient outcomes.
We strive to provide compassionate care for all different stages of their life and the best care available. Part of that is to keep up to date with the newest technologies, such as robotic assisted surgery, to give our patients the best care that's possibly available.
Dr. Riley gave me all of the information that I needed to make a well-informed decision, and I had 3 options. And as far as choosing with the hysterectomy and that leading to the robotic surgery was my best option. I have 6 children, and we were all in a wedding, and we were able to, that was 2 weeks post-surgery, we were all able to dance. It was an all-day event, and I had a blast.
Doctors Putman, Riley, and Singh are among the few physicians currently trained to perform robotic surgery, Steadfast in their mission to provide quality patient care, each doctor has become so proficient in the technique that they are teaching others how to use this technology. The hope is more doctors will begin to see the benefits in offering robotic-assisted surgery to their patient population.
Medicine is all about taking care of our patients, and what robotic surgery does is allows us to really advance medicine beyond the 21st century. And with it, we're really taking something that was an open procedure that had a lot more recovery to it and making it better for our patients, giving them a minimally invasive surgery and really being able to do that for 99% of our patients, which is a significant advance in medicine.
The patients that we've done have gone off and told their other friends, and so a lot of this, through some of the media, they'll get information, but also through word of mouth, and this is spreading pretty quickly.
And even talking to family and friends that had seen me, because some of them did not know, and they were amazed that I was actually out 2 weeks post-surgery, so it was a lot of fun.
At Seven Hills, it's not about the bottom line, it's about patient care at its purest form, understanding and responding to the holistic needs of each and every patient.
The physicians at Seven Hills are amazing. They are so competent. They explained all the options that I had. Truly a fantastic place to be.
Whether it be the best of the minimally invasive options or robotically assisted surgery, we want to provide the best, most up-to-date care if we think it truly influences their outcome, minimizes their complications, and decreases the amount of time that it would take for them to return to their normal activity.
Seven Hills Women's Health Centers, offering the highest quality, broadest access, and greatest choice to women today, tomorrow, and always, at every stage of their lives. To learn more or schedule an appointment, visit us online or call 513-721-3200.